About a potential summer COVID surge.
Yeah, that's right. Joining us live this morning is Infectious Disease Specialist Dr. Joanne Passalacqua with Harvard Healthcare St. Vincent Medical Center. Doctor, thank you for your time this morning.
Thank you. Thank you for having me.
So unfortunately, this is something we don't want to be talking about or hearing about. So I guess our first question for you this morning is, how realistic is another COVID surge this summer?
Well, I mean, as you probably know, we're just finishing up a surge right now that was related to our Passover, Easter, and spring break holiday time. I think the concern is that anything that brings people together increases the risk of more COVID. The BA1 and BA2 strains of Omicron that are circulating right now, these are variants of the Omicron virus that are circulating right now, are certainly much more infectious than the original strain of the virus. Albeit this most recent surge was very different for us than perhaps the Delta surge that we saw last summer or the original surge of Omicron that we saw in March and April of 2020. In the sense that we were seeing high numbers of people sick, but much smaller numbers of people coming into our hospital systems, sick enough to be hospitalized or for that matter, critically ill.
Doctor, let me ask you this. Are we seeing now that people, even when they're becoming sick, their symptoms are not quite as bad because of these vaccines? And even if we see more variants down the road and we do see a bit of a surge this summer, that the effects of it might not be that devastating?
Right. So currently, at least with the BA1 and BA2 variants of Omicron, the symptoms seem to be milder. Some of this is the nature of the Omicron variant, but much of this is likely also related to high rates of vaccination here in the United States and also prior exposure to other forms of the virus. So studies are suggesting that somewhere between 65 and 80% of the American population right now has some immunity to COVID, and perhaps that's contributing to milder symptoms. But we must be mindful that a certain percentage of people will still become seriously ill, and a certain percentage of people will die from this virus. And so we need to continue to be vigilant, both in our behavior and also in our awareness of what's going on.
Wonderful. Yes, great advice. I guess the advice is be cautious and get vaccinated. Doctor, thank you for your time this morning.
Thank you.